This is the Power Break Podcast number 045, an interview with Stuart Berger from the Clearwater Free Clinic. Hi, I'm your host, Bob Brubaker, inviting you to stay tuned as we seek to give you a little power in this break to help you succeed in the race of life. The Power Break Podcast is a twice-weekly show that provides a discussion of biblical principles applied to daily life and an interview show featuring stories of perseverance to help you keep pressing on. We're talking today with Stuart Berger from the Clearwater Free Clinic. Welcome, Stuart.
Well, thank you, Pastor Bob. It's a pleasure to be here.
Well, we're glad to have you and hear about what the Free Clinic the Clearwater Free Clinic, what's that all about? I mean, that's a story that I know you like to tell.
Oh, I love to tell it.
Yeah. Tell us about it.
Well, the mission of the Clearwater Free Clinic is to deliver comprehensive medical care to uninsured families through volunteerism and community partnerships. Basically, we serve low-income uninsured families with access to the quality medical and mental health care that they need to live productive lives and healthy lives. Our patients are self-employed, currently unable to work, or their employees or their employers don't offer benefits that include health insurance. These are the people we handle. Basically, we handle the people who fall in the cracks. They make too much money to get government assistance.
All right.
They make too much money to be on Medicaid, but they don't make enough to sometimes handle their co-pays or the insurance premiums that they have to pay. So those are the people that we handle.
Let's talk about how did you recruit people? I mean, obviously the word gets out that the Clearwater Free Clinic is there, but
right.
I mean, do you go out and talk to groups or anything?
Well, I go out and I talk to all the groups that I can speak with.
Okay.
Absolutely.
Hence, we're able to have Stuart with us on the podcast today.
Absolutely. Well, I just love the way we met, like right outside. And
yeah.
Here I am on your podcast,
yeah.
So it works. We do a lot of outreach. A lot of people don't know that we exist. Once again, we do a lot of groups like what we're going to be doing in a couple of weeks with the religious leaders, just to spread the word so that people know that the Clearwater Free Clinic does exist. And we do a lot of word of mouth. I'm actually going to be sitting at there is a hot sauce festival.
Boy.
I know.
We're going to put you in the hot seat with a hot sauce.
There you go. Absolutely. And we're going to be manning a table there.
Okay.
And giving out brochures and, making sure that people know that we exist.
Clearwater Free Clinic, we understand that it's not free. So where does the money come from?
Oh, good question. Good question. Money comes from many, many different sources. I'm the development director, so I'm always out there raising money. We've got some wonderful people who support us. We are non-governmental, meaning that we do not get money from the government. So we write grants. We have donors. We have, so many different ways of getting money.
Okay.
But we operate on a budget. It's only $1.5 million, but we provide over $6 million worth of programs to the uninsured.
Wow. So that means you have people that donate time and effort as well.
Absolutely. Absolutely. Okay. We've got a staff of around 16, 17 people. We have no doctors who are actually paid. All the doctors are volunteers. And we have over 200 active volunteers. Some people will help us with the events that we do. Some people come in and help in the medical room. We've got volunteer nurses. We've got volunteer pharmacists. And once again, all of our doctors are volunteers.
That is amazing. That's amazing. That's very good. It's good to hear that people are donating their time and their efforts in this very, very important part of our community. Let's talk about your involvement. How in the wide world of sports does a guy go from New Jersey to working as the development director for the Clearwater Free Clinic?
Well, it's been a long time since I've been in New Jersey, I have to tell you. I've been in development. I've been down here for 33 years, and I've been in development for it's going on about 16 years.
Okay.
I've always cared about giving back. I've always cared about humanity as a whole. And I just find being in development and working for nonprofits just really, it goes to my core. It really, I enjoy it very much. And I feel like I'm helping people, which is very, very important.
Okay. How did you walk into this? Did they recruit you?
Not to the Clearwater Free Clinic, no. Actually, it was an interesting story. I had been working for another nonprofit, also another very fine organization. and they were partners with the Clearwater Free Clinic. So I actually was sent to the Clearwater Free Clinic when they had their symbolic break down the wall, because we just built a brand new facility.
Okay.
And it opened just about a little over a year ago. And so I was sent there to help knock down the wall, and had my hard hat on, and I had my hammer and breaking down the wall. And then I'm listening to the chair at the time, Bruce Livingston, talk about the Clearwater Free Clinic. And then I listened to Jeannie Shapiro, who was our executive director. She was talking about the Clearwater Free Clinic. I'm listening to them talk, and I'm thinking to myself, wow, I think I'd rather be here.
Wow.
So
that's a great story.
But it's a small operation. There was only one development director. But about 4 months later, that development director took another position, and I called Jeannie. And that's pretty much how I ended up at
the story.
That's the story.
Well, Stuart, that's a good story. I mean, it also says that you're there because you want to be there.
Absolutely.
And you believe in what's going on there.
Absolutely. It's very interesting. We were lucky enough to have our chair, Bruce Livingston, win a Lightning Award. Are you familiar with those awards?
No.
Okay. The Lightning is an incredible organization. They give out $50,000 to a person who is a volunteer for nonprofits every home game. $50,000 every home game.
Wow.
Yes. And I nominated Bruce, and he won. So we actually get to go to the game, and we get to meet, Vinnick, who is the owner of the Lightning, and he presents us with a check for $50,000. Unfortunately, he wasn't there the day that we got it, but it was still great. We still got the check.
Still got the check.
So, but it was funny because we had to do a collage of pictures, and the very first picture that they showed on the Jumbotron is a picture of myself and Bruce. Bruce is speaking. I'm there listening to him, and you can see my head is cocked, and I'm thinking, and that's when I realized that's where I want to be. And and that really, I'm very happy it worked out that way.
That's a great story.
So
I suppose that you have many stories from your clients that come there that they're very appreciative of having the Clearwater Free Clinic.
Oh, yes. Yes, indeed. We've got people telling us all the time, quote, "You saved my life at least twice, and I will be eternally grateful." There are other people who say the services provided have been a lifesaver for me, and the people are absolutely wonderful. We've got so many stories like that, and our annual report is going to feature a few of them, which is going to be coming out very shortly.
Talk about some of the fundraisers that you do.
Oh, we've got some great funders. Absolutely great.
I asked the development director about the fundraisers. Oh, fundraisers, of course.
Yes, and they can be so much fun. We have two main fundraisers, Martinis and Matisse, and a golf tournament, which I'll talk about in just a second. Martinis and Matisse is a blast. Gets about 800 people to it every year. It's held at the Frank Crum building down in Clearwater. It's a very, very unique event. We have a lot of local artists produce works for us, and people go around and they can choose. Well, they all get tickets, and they put the tickets in a little martini glass right by the painting, and then a ticket is drawn. So somebody who wants a particular piece of work, it's like a lottery, and they can pick it, and hopefully they win. And it's wonderful to see all the people go home with the artwork that they absolutely love. But it's an amazing event. It's like the first time I went, I wasn't working for Clearwater Free Clinic yet, but I knew it was going to be a great event because I was stuck out on Missouri waiting for the police officer to direct me in. And then we got in, and there was a line of cars, and I was like, wow, this is really, really something. We have lots of tents out there. We've got great martinis. We have a lot of people who come and, donate their time and their money. And it's just a blast every year. This year it's going to be in January. It's going to be on the 17th. And you can go to our website, which we'll talk about later, to get more information
give us
about
the website. We'll talk about it now and later. How's that?
Oh, okay.
ClearwaterFreeClinic.org. That's very simple to do, and of course it'll be in our show notes too. But keep that in mind as Stuart's talking about things going on with the Clearwater Free Clinic and the ways that you can get involved. So there you go. So you have that in January.
That's in January, and I do want to make a correction. It's actually the 18th, not the 17th of January this year.
Show up at the 17th. They'll say, you have plenty of parking because nobody else is here.
You're a little early. Sorry. Yes, absolutely.
Well, Stuart said, but he corrected it.
Absolutely. So, yes, it's January 18th, 2020. And our golf tournament, which is the John H. Meek Jr. Memorial Golf Tournament. John Meek was a board member for many years, and he unfortunately passed away a few years ago, so we renamed the golf tournament in his honor. But we hold that every year at the Bel Air Country Club. Don't have the date for it yet this year. It'll probably be at the end of April or beginning of May, like it is every year. And that's also, we sell out every year, just like Martinis and Matisse. That's also tons of fun. We have big silent auction. Sometimes we have live auction events. We have a helicopter ball drop, which is, I had never seen that before. It's awesome. One of our board members gets a helicopter for us. We have 1,000 golf balls on the helicopter, and we sell 1,000 tickets. And if you happen to, each ticket is $10. So we raise $10,000. And if you happen to have the ball that is picked, if your number matches that ball, you win $1,000. So the biggest thing is to make sure that nobody gets hit by falling golf balls.
I was going to say, kind of like that TV show that dropped frozen turkeys that time.
Absolutely. We want nobody getting hurt, so we try to stay away. But that's a blast. And then the tournament's fun every year.
So how much of your budget is raised through your fundraising?
Well, that's a terrific question. 20% of our operating budget is raised by our fundraisers.
Okay.
We have smaller fundraisers also, what we call third-party events. We've got a few of them coming up, actually. And we've got over here at PDQ, right up here on Gulf to Bay. They're going to be donating 10% of their proceeds to us on Thursday, September 19th. So make sure you get out there and get your PDQ food, and 10% of what they earn that day comes to us. And we're also doing one at Pete and Shorty's on Gulf to Bay.
Yeah,
that's going to be October 23rd. They are actually giving us 20%. No competition between PDQ and Pete and Shorty's. We're happy with whatever.
Oh, yeah.
But they're actually going to be doing 20% of the proceeds all day long.
And what is the date on that?
All right. The date on that is October 23rd. We're going to be hosting a party also from 5:30 to 8:30. And we're going to have Mike Hagan. He's going to play his guitar for us. And, we're going to have some drink specials. It's just going to be a blast. I just hope everybody can come out.
So the smaller fundraisers you do from time to time, and then you have two large fundraisers.
That's correct.
But, so we're whittling down the operating budget now. Where's the rest come from? Donations, specific donations?
Donations, and tons of it is in kind.
Okay.
So what this means is, the volunteer physicians, nurses, pharmacists, all of that time.
Okay, so you figured that in.
Yes, correct.
If you had to pay them, this is what
exactly
your budget would be, but they donate their time.
That's correct.
Now, most of these people are working elsewhere. They just come over to the Clearwater Free Clinic and donate specific time to you?
That's correct.
Okay.
Yeah.
That's amazing.
Yeah.
What's the attitude of people that do that?
It's.
I take it that the people that do that.
It's amazing.
They're very positive people, and they love what they do.
Absolutely. Absolutely. They love what they do. They feel like they're giving back to the community. They feel like, very interesting, actually. I spoke to one of our doctors several weeks ago, and we interviewed him for a new video that we're doing. And one of the things that he said was that he expected to walk into the free clinic and see a bunch of homeless people. And he was surprised to find that we don't serve the homeless people. We serve up to 200% of poverty level, but there are programs that will take care of people who absolutely are indigent.
Right.
All right. So once again, we take care of the people that actually absolutely fall into the cracks. I mean, the people that we take care of are the people. These are the people who could be working on your roof. These are the people who could be mowing your lawn. All right. These are the people who might be serving you at PDQ or wherever. They're earning money, or they're self-employed, but they just don't earn the kind of money that you need to be able to get private health insurance nowadays.
Wow.
So we get, going back to your question before about where we get our operating money, we're partners with quite a few different organizations in this area, including Berger.
Okay.
And one of the reasons why Berger is a partner of ours is that we save a lot of money for people who don't no longer have to go to emergency rooms.
Right.
A lot of times, if people have chronic conditions, they'll wait until it's horrible, and then they'll go to an emergency room. And emergency care is the most expensive care there is.
Right.
So we save, by not having people go to the emergency room, we save hospitals lots and lots of money.
Oh, yes. Oh, yeah.
Lots of money. So, one of our biggest partners is Berger.
That's amazing.
It is. It absolutely is. But we've got so many different partners. It's incredible because we have so many different programs. I mean, Frank Crum, Largo Medical Center, sometimes they will send, doctors or residents over to us. Pinellas Community Foundation, Lions, Rotary. It's just amazing, the community backing us as they do.
As development director, have you felt like the city of Clearwater and the people in Pinellas County are behind what you're doing at the Clearwater Free Clinic?
I feel like everybody's behind us. We will serve the people who live in northern Pinellas County because there is a free clinic down in St. Petersburg.
Okay.
But it's just amazing the support that we get from everybody. We've had state representatives come to see our new facility. We are willing to tour anybody because we're very, very proud of our new facility. It's 11,000 square feet. It's actually double the facility that we had been in previously. And we were lucky enough to open it debt-free.
Wow.
We had a very, very generous sponsor who helped us do that.
That is tremendous.
Yeah. So, getting back to your question, it's like the community support is just amazing.
That's the city of Clearwater. That's people around here are good people.
City of Clearwater, we handle people from Dunedin. We handle everybody up to Tarpon Springs.
Okay.
Not across the Pasco line, but everybody in North Pinellas. And we've got donors and sponsors from all over the area.
Talk to me about the average day at the Clearwater Free Clinic. How many people are seen?
Well, that really depends on the doctor, so it's actually hard to give a specific number. I can tell you that, in our medication room, we do sometimes up to 200 scripts a day. We have a lot of people who have chronic diseases, so they will sometimes come back for multiple appointments. We also teach we've got classes also in our new facility because we've got a beautiful conference room.
Talk to me about that.
Which you're going to see in a couple of weeks when you come out for the religious leaders.
A free breakfast.
Absolutely. Offer them breakfast, you'll fill the room. But no, I'm really looking forward to that. It's just the support is just amazing.
Talk to me about you said there are classes. What kind of classes would you find at the Clearwater Free Clinic?
Well, one of the things we try to do is create healthy communities and healthy people. So one of the classes that we teach is a healthy living course. We have a smoke enders course as well, trying to get people to quit cigarettes because cigarettes are just, they're really just bad things for a body, what they do to a body. And we have a lot of people who have diabetes, so we also teach, how to handle what you should eat when you have diabetes and how you can make yourself healthier. Because a lot of diabetes, especially type 2, is a result of lifestyle choices. So
I know that there's a doctor that I listen to his podcast from Cleveland Clinic, and he mentions that sometimes people that should be watching what they're eating are actually almost forced because of their low end of income or something into eating poor choices.
Yes, absolutely.
That actually send them down the road to diabetes and other diseases.
Oh, absolutely. A lot of prepackaged stuff, a lot of carbs and a lot of heavy sugars.
So you have some specific courses to help people get out of that mess.
We do.
That's good.
Yep.
That's good. So it's more than just write a script for people and send them on their way. You want to help them change their lifestyle.
Absolutely. We want to help them change their lifestyle.
Yeah.
Because our function is to keep people healthy and working. Mm-hmm. That's one of our biggest goals. So yes, we teach we teach these courses to try to make sure that people stay healthy and not need our services anymore.
Sure.
Which is the best result you can have. We're also looking, once again, we've just started this. We are willing to host people who want to come in and teach things like this. Like the Smoke Enders is actually taught not by somebody in our clinic, but Smoke Enders themselves has an instructor that they send to us. And if anybody, our community room is open. So, we've hosted the Lions there before. We're willing to host anybody. Well, not anybody.
Within reason, of course.
Within reason, yes.
But talk to me a little bit about some of the doctors that are associated there. Mm-hmm. What's the longest tenure of doctor that's been associated with the Clearwater Free Clinic?
Oh, my gosh. We've got one doctor who has been associated with the Free Clinic since the beginning, which is 1977.
Whoa.
Yes.
Whoa.
He was very young at the time, still with us, still volunteering with us. He's absolutely awesome.
Isn't that amazing?
Yep.
What is the attitude? I like to talk about perseverance, but as you see a doctor that does that, what would you say his secret to perseverance in doing that would be?
He totally loves what we do. Mm-hmm. Wants to give back to the community. Feels like he's very, very fortunate. And as far as why he continues to do it, I believe they get a good feeling out of it as well. It's not just feeling that they're helping other people. They're doing it also because they're helping themselves and they're helping their spiritual beings.
Yeah, they're giving back.
They're giving back. Because we're not a religious organization, but what we do is God's work. We're taking care of people.
There you go. Well, Stuart, it's good to have you with us. Before we go, let's talk a little bit about how a person that is listening to this could get involved with the Clearwater Free Clinic. I mean, there's several areas in which they could get involved. How would the development director direct a person that way?
All right, this development director would direct people to talk to our volunteer coordinator,
okay,
Sue Murbach, who is awesome. Her husband volunteers at the clinic. She's been very involved with Martinis and Matisse since the inception, I believe. But she's our volunteer coordinator. And her email is smurbach, MURBACH, at clearwaterfreeclinic.org, which is one word. And we have a lot of different volunteers. Not all of them are clinical. Not all of them are nurses. We have quite a few people who volunteer at the desk, checking people in, checking people out. We have quite a few people who do volunteer to help with the medications. As I said before, we have over 200 active volunteers. A lot of people just work for the events that we do. Martinis and Matisse for certain. We use a lot of volunteers for that particular event. So Sue is our volunteer coordinator, and she's the one to get in touch with.
Well, I'm sure that there's other ways a person wanted to just give on a regular basis, they could do that too through the website. Absolutely,
through the website. They can get in touch with me. I'm always willing to talk to somebody who's interested in giving to the clinic. My email address is sberger, and that's BERGER at clearwaterfreeclinic.org. And certainly you can donate on our website, which, www.clearwaterfreeclinic.org. And I am more than happy to take phone calls, and my direct line is 727-331-8149.
All right.
And we're always happy to talk to people. We're always happy to bring people through the clinic so that they know what they're actually donating to, and to see the good work that we do on a day-to-day basis.
Stuart, it's great to have you on this program. I'm really impressed because you are a person that every time I've talked to you, you're fired up.
Thank you. Likewise.
So, being fired up as he is, how do you do that on a daily basis? I mean, obviously, you're doing something you love,
absolutely,
or something you believe in. But how do you persevere? Keep going on.
Well, how do I persevere? I just know that deep inside of me, I'm not happy with myself if I'm not helping other people. One of the things that I live by is a quote from Horace Mann. He was a 19th century educator, and he said, quote, "Be ashamed to die before you have won some battle for humanity." And that's what motivates me on a day-to-day basis.
That's what got you started with the Clearwater Free Clinic.
They caught
your attention.
They caught my attention. They did indeed.
Well, Stuart, thanks for joining us today.
Thank you, Pastor Bob. It was a pleasure.
This has been the Power Break Podcast with another story of perseverance to encourage you to keep pressing on in life. If you'd like more information on the Clearwater Free Clinic, you'll find that information in today's show notes at bobbrubaker.com. Look up the Power Break Podcast. This is show number 045. The Power Break Podcast is a twice-weekly show that provides a discussion with JT and myself on biblical principles to help you succeed in the race of life, and an interview show, The Stories of Perseverance. Please subscribe wherever you have downloaded the podcast, and please leave us a rating and a review. Check out today's show notes, the books, the Power Break blog, and more at my website, bobbrubaker.com, and listen next time for the Power Break Podcast.